Most people know oatmeal as a healthy breakfast, but its impact goes far deeper when it comes to blood sugar control. Listen to this amazing case report from an ICU.
Check out this case report of an oatmeal intervention for severe insulin resistance in the ICU. Within 48 hours of admission, the patient developed such severe insulin resistance she required more than 200 units of insulin per day. Up until then, the patient received standard diabetic tube feeds, which obviously were not working. So instead, they dropped oatmeal and vegetables down the tube instead, presumably using a really good blender, and lo and behold, it worked. But you got to see the numbers. Yeah, her first blood sugars of the day dropped from around 250 down to about 100 5 days later. But that near normal blood sugar was on 160 fewer units of insulin, down from over 200 units a day. The lower blood sugar is on 160 fewer units of insulin.
Pretty impressive results, huh? In just 5 days of oatmeal and vegetables, near normal blood sugar on significantly lower insulin, in just 5 days. Now, what makes oat so effective? The secret lies in a special fiber that oat has named beta glucane.
There's been over a dozen randomized controlled trials looking at the metabolic effects of oats intake in patients with type 2 diabetes. And oats were found to significantly improve both short-term blood sugar control and long-term blood sugar control, in addition to lowering cholesterol levels. We think the benefits arise from a fermentable fiber in oats called beta-glucan, because you can get cholesterol lowering even if you just give the oat fiber straight, as well as an improvement in blood sugar control and insulin sensitivity in both type 2 diabetics as well as type 1 diabetics.
Please note that Dr. Greger said fermentable fiber. So, beta glucan is a fiber that our gut bacteria can ferment and create short chain fatty acids such as butyrate. These short chain fatty acids enables multiple hormone signaling and metabolic functions that directly and indirectly improves insulin sensitivity and reduces insulin resistance. Now, not all fibers are fermentable like beta glucan, even though all fibers are generally good for health. Now, this magical benefit is not only limited to oats. For example, another whole grain, barley, seems to be pretty good too. But the effects of oats have been studied the most in the research I reviewed.